Hello everyone, and the topic of this week is pediatric nursing. At the beginning, I want to show you a video about this topic. After that, I'm starting my presentation and we learn some questions. At the last, we play Kahoot. Okay, and I'm showing this video.
If you're an adult care nurse who needs a change and you have a big heart for kids, a switch to pediatric nursing could be the right career move for you. At Cincinnati Children's, we are a top-ranked, magnet-recognized medical center that offers competitive salaries and benefits and the added reward of smiles from resilient kids.
The rewarding thing about working with children is that they need me. At the end of the day, I feel like I truly make a difference in their outcome. I think adult care nurses should consider working in a pediatric facility for the same reasons I did. I needed something different. I needed something fresh.
We offer a comprehensive orientation to pediatric nursing for experienced adult care nurses making the switch, and for new graduate nurses, we offer a one-year residency.
I love learning. This is exactly what I want to do.
When I came, I was very scared. I pretty much felt like a new grad all over again, and I had to learn how to not only do pediatric nursing but learn how to care for peds. So it was a totally different learning curve, and I was surprised at how much I loved it from day one.
We also offer a supportive working environment, tuition reimbursement, low nurse-to-patient ratios, and outstanding mentorship.
I decided to become a pediatric nurse from adult care just because kids are fun. Well, one of the biggest benefits that I found once I started working here at Cincinnati Children's was the patient-to-staff ratio. I did home health where I had tons of different people, and then even when I did my role transition working in a hospital where I had 4 and 5 patients, coming here, it really allowed my focus to be on the kids that I had. And so that way I could provide them top quality care.
And at Cincinnati Children's, we value your perspective on how we can be even better.
Here, it's very much patient-centered. If it's not safe for the patient, if it's not even good for the patient, if it's even remotely, slightly bad for them, we're not going to do it. So I think that focus is huge. I have an example of that several years ago. Cincinnati Children's, in an effort to save money, switched their diaper wipes. The nurses all complained. They hated them, they didn't work, they were not good for the kids. We went to management in 2 weeks. They had completely restocked the entire hospital and we had our old ones back. So I think that just really speaks to the fact that we care about the kids and we care about the nurses.
When I came here, I felt like I was doing something special. I couldn't be happier with my career choice.
I love my job because it gives me an opportunity to work together with a team.
One of the greatest benefit I've gotten since working at Children's is able to balance my home life and work life. It's not just a saying, they really push that, they really drive that, and you see it. My schedule has been so much better since I've started working at Children's. I've been able to handle anything that goes on at home, and they're very flexible and very understanding. I'm a single parent, so it has allowed me to do what I like to do, at the same time be there for my family.
I feel like the opportunities as a nurse at Cincinnati Children's are endless. You just have to have the will to go get it. I've been challenged to become the best nurse that I can possibly be here at Cincinnati Children's, and I hope that you would consider coming to Cincinnati Children's too.
We are part of a thriving community with major league and collegiate sports teams, arts, entertainment, affordable housing, and great schools. Find out what we're all about at cincinnatichildrens.org.
We are Cincinnati Children's.
Changing the outcome together.
Come join our nursing team. Find out more. Email us at nursesforkids@cchmc.org.
Okay, I'm sharing my screen again and starting my presentation. Pediatric nursing. Pediatric nursing is the medical care of neonates and children up to adolescence, usually in an inpatient hospital or day clinic. The main role of pediatric nurses is to administer directly procedures and medicines to children according to prescribed nursing care plans. Nurses also continually assess the patient by observing vital signs and developing communication skills with children and family members and with medical teams. Being a support to children and their families is one component of direct nursing care. Awareness of the concerns of children and parents, being present physically at times of stress, and implementing strategies to help children and family members cope are all part of the work. Its first question: a patient and her husband are positive for the sickle cell form. The patient asks the nurse about chances of her children having sickle cell disease. Which of the following is appropriate response by the nurse? A. One of her children will have sickle cell disease. B. Only the male children will be affected. C. Each pregnancy carries a 25% chance of the child being affected. If she had 4 children, one of them would have the disease. Answer is C, because in autosomal recessive form, both parents are carriers. There is a 25% change with each pregnancy where the child will have the disease. Question 2. An 8-year-old child has been diagnosticated have iron deficiency anemia. Which of the following activities is most appropriate for the child to decrease oxygen demands on the body? A. Dancing. B. Playing video games. C. Reading a book. D. Riding a bicycle. Answer is C, because reading a book is a restful activity and can keep the child from becoming bored. Choices A, B, and D get to too much energy for a child with anemia and can increase oxygen demands on the body. Question 3. Which of the following foods will the nurse encourage the mother to offer to her child with iron deficiency anemia? A. Rice, cereal, whole milk, and yellow vegetables. B. Potato, peas, and chicken. C. Macaroni, cheese, and ham. D. Pudding, green vegetables, and rice. Answer is B. Explanation is potato, peas, chicken, green vegetables, and rice cereal involve specific amounts of iron and therefore would be recommended. Milk and yellow vegetables are not good iron sources. Rice by itself also is not a good source of iron. Question 4. A child presents to emergency room with the history of ingesting a large amount of acetaminophen. For which of the following will the nurse assess? A. Hypertension. B. Frequent urination. C. Right upper quadrant pain. D. Headache. Answer is C, because after ingesting a large amount of acetaminophen, the child would complain of right upper quadrant pain due to hepatic damage from glutathione combining with the metabolite of acetaminophen being broken down. Question 5. The nurse is caring for a baby following a cleft lip repair. While comforting the baby, the nurse should avoid A. Holding the baby. B. Offering a pacifier. C. Providing a mobile. D. Offering sterile water. Answer is B, because the nurse should avoid giving the baby a pacifier or bottle because sucking is not permitted. Question 6. A newborn's failure to pass meconium within 24 hours after birth may indicate which of the following? A. A ganglionic megacolon. B. Stenosis. C. Intussusception. D. Abdominal wall defect. Answer is A, because failure to pass meconium of newborn during the first 24 hours of life may indicate Hirschsprung disease or congenital aganglionic megacolon, an anomaly resulting in mechanical blocking due to insufficient motility in an intestinal segment. B, C, and D are not related in the failure to pass meconium of the newborn. Question 7. A nurse has just started her rounds delivering medication. A new patient on her rounds is a 4-year-old boy who is nonverbal. This child doesn't have any identification. What should the nurse do? A, contact the provider. B, ask the child to write their name on paper. C, ask a co-worker about the identification of the child. D, ask the father who is in the room the child's name. Answer is D, because in this case, you are able to determine the name of the child by the father's statement. You shouldn't withhold the medication from the child following identification. It's question 8. A nurse is caring for a baby that is been diagnosed with a congenital heart defect. Which of the following clinical signs would most likely be present? A, slow pulse rate. B, weight gain. C, decreased systolic pressure. D, irregular WBC lab work. Answer is B, because weight gain is related to HF, congenital heart defects. Question 9. A mother has recently been informed that her child has Down syndrome. You will be assigned to care for the child at shift change. Which of the following characteristics is not related to Down syndrome? A, time increase. B, brachycephaly. C, oily skin. D, hypertonicity. Answer is C, because the skin will be dry and not oily. It's the last question. Which of the following can indicate left-sided heart failure in baby? A, fever. B, low appetite. C, increased respiratory rate. D, crying. Answer is C, because shortness of breath and perspiration during feeding can also indicate left-sided heart failure. Thank you for your attention. Now we play Kahoot.
Thank you.
Okay, let me open the Kahoot. Okay. Okay, it's our code. Please enter the code. I'm waiting. Okay, I'm starting. A 4-year-old is admitted with acute leukemia. It will be most important to monitor child for answer. The nurse is caring for an 8-year-old following a routine tonsillectomy, which finding should be reported immediately. Which of the following health teaching regarding the sickle cell crisis should be included by the nurse? A nurse is performing developmental assessment on an 11-month-old. Which one is the most concerned? Which signs and symptoms will observe in a child diagnosed of laryngotracheal bronchitis? It's the correct answer. Inspiratory stutter is predominant symptom being admitted from a surgery following a tonsillectomy is? Risk for aspiration is correct answer. A 6-month-old with ventral septal defect regulation of his heart rate, which finding be reported? Which one is the most important? Yeah, it's the correct answer. A 2-year-old is hospitalized with suspected interception. Which finding is related? A nurse is educating a patient about Kawasaki disease. Which one is correct? The first course of inactivated polio vaccine is given at the age of Who is the winner? Congratulations! Okay, thanks all of you. It's my first, so I'm excited. If I have mistakes, I'm sorry, all of them. Next Thursday, we will meet again, okay? See you.
Thank you for your presentation.